Welcome back to another episode of Science and Soul. On this episode, we're talking about when the body speaks in mysteries, the science and soul of medically undiagnosed syndromes. So, this episode will center around trauma, and we'll get different perspectives on that. As a reminder, on this podcast, we have two perspectives. The science is represented by Dr. Stephen Brewer, who is medical director at Canyon Ranch and a medical doctor and family physician of vast experience. And we have Dr. Elizabeth Brewer, who is a doctor of clinical psychology, integrative psychotherapist, professor, yoga and movement instructor. And so Elizabeth represents the soul, and we'll get both perspectives on these medically undiagnosed syndromes and how trauma uh, feeds into this. So let's jump right in. What can you tell us? Let's start with you, Steve, about medically undiagnosed syndromes and trauma.
This is an area that has followed me through all my years, my 40 plus years of practicing medicine. It wasn't something that I sought out to learn about, but these patients would come to me over the years. And I was always puzzled as to what was going on with them. And these are, and always when you hear doctors use the word syndrome, it means they basically don't know why you've got what you have, but you have these particular symptoms associated, and you group these symptoms together and you come up with a name of a disease or whatever it is. And some examples of these are fibromyalgia. We used to call it fibrositis in the old days because we thought there was itis means inflammation, fibro means muscle. So we used to think it was inflammation of the muscle because fibromyalgia is just these people have just point tender areas on their muscles up and down their legs, their arms. But if you biopsy them, there's nothing there. If you do blood tests, there's nothing there. The blood, and you could never figure out. So you'd always tell the patient, "Well, I don't know. It must be all in," and people would say it must just be in your head. Okay. Some other ones, people have irritable bowel. They don't know why they have all this GI upset. They've been scoped. They've looked at top and bottom. They've done scans, blood tests. Everything's negative, but they have all these terrible symptoms. There are people with a lot of chronic pain syndromes. It just seems disproportionate to what they're actually seeing with the patient. I mean, somebody says, "Oh my gosh, I have the worst back pain I've ever had." It persists, it keeps going, and you do scans and you can't find much going on. So these syndromes are things that you've had for not for a short period of time, but several weeks, months, and sometimes years with some of these people that they've never really come up with a diagnosis of why do you have these. And I originally started seeing these patients back in the early 80s when my patients would come in with the symptoms of pain and I couldn't put a finger on it. It's a lot easier to do an MRI and find out, oh, you have a disc and that's what's causing their pain and what can we do to treat it? But people would come in with certain kinds of pain syndromes or some of these syndromes and I had no answer for them, but I would see two major patterns with these people. And this is why Elizabeth is very much going to be involved with this discussion. The first is at least 90% of the time with these people, I would find that they had some type of physical or emotional trauma, seemed to be the beginning of these things. And the way I always knew it was maybe a trauma, maybe what's causing it. So I'd ask the person, how long have you had, for example, irritable bowel or the fibromyalgia? And if they give you a specific years and most people go, I've had pain for quite a while, but I can't say it's been 3.5 years. And you go, so that's your first key is to, did something very traumatic happen 3.5 years ago? So I would see the trauma aspect. I couldn't link it. I didn't know why it was causing these symptoms, but I would see it was kind of a observation of my practice. I would see some type of trauma, and I can maybe give you some examples later. The other thing I would see is it was rare for them to come in strictly with fibromyalgia or strictly with irritable bowel. These people, they would commonly have more than one. In fact, is it was not unusual for them to come in and say, "Hi, Dr. Brewer. I know you think I'm kind of crazy, but I have irritable bowel, chronic fatigue, fibromyalgia. I've got these chronic headaches, low back pain, and I've got this rash that what doesn't seem to go away." And in my years of practice, initially, I would say, well, I don't think you can have all those at the same time, but they did, and these are people, very believable people. So there are these a group of symptoms that in the past we haven't been able to figure out why you have them, and they're very significant. In fact, is many times it is limiting their life. It is really restricting what they can do in life because of these syndromes, and then they're all very frustrated, and over the years, many of these people ended up on terrible medications like Oxycontin because they have chronic pain, and who knows what you were treating. So now you have another problem with them. You're dealing with the opiate abuse or addiction that these people have. Some of them turn to alcohol because they think it gives them a little relief. So a lot of the addictive behaviors that happen with these people because nobody's been able to figure out what's been going on with them. So I've been following these people for a prolonged period of time and always trying to figure out what's the source of this problem. And now, after all these years, we may be coming up with some answers.
It's so interesting. When you say like 90% is usually linked to trauma. And I'm really curious, Elizabeth's perspective on this. I want to ask you, what is trauma and how does it lead to such syndromes?
Well, what is trauma? Trauma, if we are going to directly translate it, is an unprocessed event. And so, how does an unprocessed event form into one of these symptoms in the body? Well, in practice, the person that I sit with often says something like, my doctor looked at the tests and told me nothing's wrong. No one believes I'm suffering. And I can feel it in the room when they say that, how disbelief becomes its own kind of pain. And that disbelief is a second wound. The first is the body's distress, and the second is being unseen inside that distress. So it's an emotional wound layered over a somatic one, a relational rupture that tells the nervous system, you're alone in this. And when the body hears that, it then tightens further. So our muscles brace, our breath shortens, maybe our digestion stalls. And then the sympathetic system gets louder, trying to compensate for a world that won't listen. So this is trauma in the making, not from a single event, but from the slow erosion of trust. Say trust in, looking at you, Dad, trust in medicine, trust in others, and trust in one's own body as a reliable home. So when I sit with that person, my first task is not to diagnose or interpret, but actually to believe. So to meet their body with presence instead of doubt. Because the moment someone feels believe, the nervous system gets new information. You're not alone and safety is possible. And sometimes that's the first sigh in the body in months.
So are you saying trauma develops from, well, an event unprocessed and then it's kind of compounded when uh someone feels unsafe or disbelieved,
Yes,
and then their sympathetic nervous system starts to get more and more active. And is
yes.
that what leads to these types of conditions like central sensitization and fibromyalgia and stuff like that?
Should I step
Yes.
in, or you want
Please,
to go here,
please,
Elizabeth?
or both.
Well, my piece is, actually, it's interesting how Elizabeth explains that it's just more than just the event itself. It's what the event creates in our body, that it's, as you pointed out, Zao. But in a pathophysiologic uh, aspect, this trauma, whatever it is, seems to impact the brain with this surge of adrenaline and the processes that Elizabeth was just talking to about, and cortisol levels and all this excess in stress response hits the brain, and the brain is injured, and it develops an inflammatory response. That is, in the audience, that you've mentioned it a couple of times, this thing called central sensitization. And that's the pathophysiology. And it's all in the words. Central means the problem is in the central nervous system, which is the brain and the spinal cord. That's where the problem is. It's not in the muscles. It's not in the gut. Um, it's not in the jaws like TMJ. It's in the brain. And this is what's injured. And they've proven this. They've shown that the brain develops inflammatory markers. It actually changes neurotransmitters that are associated with pain. So the brain is affected, and then you go, oh my gosh, explains why the person can have different syndromes at the same time, because the problem is in here and affecting different areas of the brain versus the problems in the muscle, and we interpret the pain that way. It wasn't until, this is what blows me away. It wasn't until about 2017 that we knew that the brain can produce pain. I mean, before then, we think of pain as either coming from inflammation or injury. Okay, you've been stabbed, it causes pain. You got a tonsillitis, it causes pain. And then there's neuropathic pain, in which the nerve itself is injured. If you have a herniated disc, you have pain down your leg. If you have diabetes that affects your peripheral nerves, you have burning feet. So that's where in the periphery, these nerves, the nerve itself are injured. But we really didn't realize how much pain can be just directly started in the brain, and it's for that reason the brain is eliciting the pain in the muscles or the pain in the bowels or whatever. And so, but what sets it off is this trauma and I think it's so appropriately stated by Elizabeth that it's unprocessed trauma, because I think the last I heard that we all have trauma. You can't go through life without trauma, but about 85% of trauma we are able to resolve it somehow. But that other 15%, a lot of us can't resolve it, and this keeps ruminating. And then those people need to see my daughter to help them process this in a better way. Um, because I've seen it clinically with these patients over the years. They never, even if you come up with the idea of that a trauma set this thing off, they never seem to get better until they had gone into counseling to help them process that trauma, because it just keeps coming back and back. But those people that have learned to process it, they seem to do so much better in the long run.
Go ahead, Elizabeth.
And when their medical doctors believe that their pain is real. And the brain isn't inventing suffering out of thin air. It's pattern matching, it's protecting, and it learns from every injury, every stress, every betrayal, and it stores those patterns so it can warn us sooner next time. But sometimes the alarm keeps ringing long after the fire is out. And that's what I have learned to be called now in the medical world central sensitization. And the neural networks that once helped you survive become over vigilant. So sending out pain even when there's no tissue damage, because the system safety still feels uncertain. So yes, the brain creates pain, and I would say, but always for a reason. And the nervous system is saying something here still doesn't feel safe. And as I said before, when the message isn't understood, the volume goes up. Get more signals, more tension, more fatigue, more fog, more nausea. And then the body starts shouting.
Elizabeth, can you tell the audience some of the techniques that psychologists use to specifically address trauma?
To specifically address trauma. Well, there are a number of different techniques that we can use. I mean, I could talk for hours about it. So what specifically,
Like
I mean,
EMDR and brain spotting and things like
go
that.
for it.
No, you're the expert, not me, but I just know that my patients, there are certain techniques that are more just specifically to to address the trauma issues. EMDRs, eye movement desensitization. I forget the whole word. What it does basically is helps a person going from right brain, left brain, right brain, left brain, and then in the process of doing that, by alternating going from one side to the next, then you are able to access where the trauma is, and then open the door so you can hopefully deal with the trauma. There are other techniques out there that have been successful. It's not, it's been around for a while. I know like brain spotting's been around at least 10 years. I don't know how EMDR has been around a lot longer than that, uh, 15, 20 years at least. But there are techniques, there are certain psychologists that is their specialty in dealing with these trauma issues. But again, these people do not get any better unless you deal with the trauma. There are techniques and things that I will do as a physician. I will give them, put them on, make sure they're on an anti-inflammatory diet because this is inflammation on the brain, right? Certain things like omega-3s is very helpful. Um, we also there are certain medications now that we didn't have in the past, that one is called naltrexone at very low doses. It's been shown to be neural anti-inflammatory. And this has been seen to be very helpful for these people. It's not, there's no 100% anything, but in the past I had really had nothing, but now I have something. And in my personal experience, and I don't know the exact numbers, I see people on the low dose naltrexone with these syndromes and other things like long COVID. I think is a lot of the same pathophysiology. Is I'm successful about 50% of the time in helping these people. We have other things that we use medically, more invasive stuff to kind of block that over-sympathetic response that Elizabeth was talking about. We actually you can inject a sympathetic ganglion that kind of calms it down. But that's kind of like last resort. It's not permanent, but certainly for these people that just their sympathetic symptoms are going out of control. They're extremely anxious. You can sometimes inject these people and block their sympathetic response, and it calms them down for the first time in weeks and months. So it all depends on each scenario. But the one I always use with these patients that I think it's not funny, but it's kind of funny is I tell these people when I feel that they have this central sensitization, I will tell them, everybody's been telling you this is all in your head. I'll go, it is, because the problem is it's a brain injury, a brain inflammatory condition. And what is exciting for me is after dealing with these patients for 45 years, that I can actually have an explanation, And in the past, they see everybody else and they go to multiple specialists and they come back empty-handed and nothing has been accomplished yet, right? They just go, I'm just still in pain, nothing, nobody's helping me. But it's amazing and maybe Elizabeth can comment more on this, but when I tell a patient that I don't know how well we're going to be able to treat it, but we know what the problem is, and you're not crazy. Suddenly, these people just their whole demeanor changes, and they suddenly went, "You mean I'm really not crazy?" And the answer is no, you're not. You have this problem, this neuroinflammation, and even though it doesn't directly decrease the pain that they're having, the knowledge now that they know what's going on, they know what maybe they can or cannot have an impact on helping themselves, is very powerful. I mean, how do you think about that, Elizabeth?
Yes, there are many brilliant techniques in the therapeutic space, EMDR that you mentioned, which is bilateral stimulation, parts work, internal family systems, somatic tracking, breath work, CBT to some degree. And all of them are precise and powerful in some cases, but trauma isn't something to fix. I know you probably feel differently, but I would say it's something to understand how the body learned what safety feels like and what danger is still alive inside, and to understand that every symptom has a logic. You know, every defense that we have once had a purpose. There's the freeze, the fight, the collapse. And they are forms of intelligence. So when we stop trying to fix it and start trying to understand, then the body begins to trust again. And the nervous system starts to unfold its story, not as a problem to solve, but as something to listen to. And understanding doesn't mean that we have to analyze every memory. It does mean staying present long enough for the body to reveal what it already knows. And trauma heals at the speed of relationship, not at the speed of intervention. And yes, technique matter, but only when they are guided by understanding. Otherwise, they're just more noise in the system that's really begging to be heard.
I'm curious when you say trauma is not something to be fixed, right?
Mhm.
But to be understood. Is it not possible to understand something but still be experiencing the pain caused by that thing? And then I guess I'm struggling to not want to fix that, right?
Yeah.
So I'd love to hear your perspective on that.
Well, the relationship can change, right?
Mm.
The relationship to pain, the relationship to suffering.
And I want to fix too, Zale. It's my job to see what the best I can to fix the best I can. So yeah, I mean, I don't think she's saying you can't. Well, the trauma's there. It will always be there. It's how you address it and deal with it. I think what Elizabeth is saying. But I want to clean it up the best I can and then address the downstream effects from it. And that's medication or whatever that I'm dealing with the effects. But until you deal with the upstream with the hand in the air there, until you deal with the upstream, you're not better. I don't think the downstream ever really gets corrected.
Elizabeth.
Well, here's a question, maybe for both of you. Can we fix the past?
We try. No, the past is the past. Yes. I don't think we're saying anything differently. I think You're just being more honest about you know.
So,
I fell off the horse. I will have my memory is I always fell off the horse. It's how I processed falling off the horse and how I felt about it and how I dealt with the pain and how I dealt with the lingering. Does that mean now that I'll never want to get on a horse again? So I think I'm glad you pointed that out, Elizabeth. Is the trauma is always there, but how do we deal with it and how do we move forward with that trauma still there? Or am I not
well,
with you?
we can't unhappen what happened. I don't even know if
Yes.
that's a word. We can't rewrite the moment that the body braced or the words that were never said, but we can relate to it differently.
Hmm. So essentially, we would be having a different response to the trigger.
Mm.
Was that fair to say?
Yes,
Mm.
stunning. Because then the nervous system begins to realize the danger isn't happening anymore.
Hmm. So we have a couple questions from the audience, from our listeners. Um, One of them I think is relevant right now is how does one recognize trauma? Because if you're to relate to it and evolve your relationship with it, how do you recognize it in the first place? Even when someone sees themselves as strong, right? That person might not realize that they have specific traumas.
Go ahead, Elizabeth.
I'm curious about your answer, Father.
Specifically, how do we know when it is trauma or
Mm-hmm.
um, I think it's different for every person. You'll have two people have an event happen, a colossal event happen between, and two people witness it. One person didn't process it right and think it's the worst thing it's affected them, and the other person went, "Oh, was that a big deal?" I think it's extremely individual unless, it's a major traumatic event, war or whatever. I mean, those are, or an automobile accident or something very extremely, a loss of a close relative and at a young age. Those are traumatizing events. But I think, as Elizabeth said, we all process it differently. And some of us, um, we take it to heart. It never seems to leave us. And it's one of those, we ruminate about them a lot, more and more and more. We just can't get them out of our system. Or probably, and this is more Elizabeth's world, do we bury it down in our subconscious and it intermittently tries to come out intermittently when we don't really know? Why are we yelling at somebody that they really didn't do something bad? Well, maybe it's because that incident happened earlier in the day. Now it's coming out and you didn't realize. It's not because they dropped your books on the floor. It's because what happened earlier in the day, that major trauma, and you try to suppress it, but that comes out in ways that you didn't realize it was coming out. I see that all the time.
So the body is one system, and so is the culture and the world that we live in. So I think even my father said this earlier, we all carry trauma. And we also carry what the larger systems couldn't hold. The silence maybe of generations that held themselves as strong. The pace of society that rewards dissociation. The medical systems that here in the United States ask for evidence. So, to locate trauma, it may not be presenting physically in the body, but it could present in our relationships. And sometimes I'm really actually impressed by my father's description. You know, sometimes trauma looks like an overreaction or an underreaction. And it could maybe hide in our exhaustion or our hypervigilance, uh, our inability to rest even when we are physically safe. It might be a flinch that we can't explain, or the need to please. It's one for me. And the body remembers often what the mind forgets. And so the remembering can show up in patterns. It can be in our health, it can be in our sleep, the silence, relationships. And I think that it's important that when we recognize trauma, it's not about labeling the self as broken, but noticing where the system is still organizing around survival. So I often tell clients, you know, if you find yourself reacting bigger than the moment or smaller than the moment, your body might be remembering something it never got to finish. And so a simple question then to ask the self is, what in me is still trying to protect me?
Mm.
And I know you used the word strength. And strength can become kind of armor, a way of saying, I'm fine. I'm impersonating my father. I'm fine. And when, you know, individuals carry trauma, um, we might not always see it. And there's a kind of a paradox of trauma in the strong, you know, that they've learned to override every signal that would reveal their need.
Mm.
And so a part of recognizing trauma is realizing that resilience and suffering can coexist. And being strong doesn't mean that we're invincible. It does mean you adapted brilliantly.
So when people have certain behaviors, I just want to get in this last question from the listeners. When people have these behaviors, let's say overreaction, and these kinds of things, is it always trauma linked to it? Is there ever a time where it's not quote unquote real trauma and trauma is an excuse?
Ooh. So can you ask the first question? Because I feel like I want to answer that question two different ways.
Well, is it always trauma, right? And how is it decided that it is linked to trauma, certain behaviors? And I guess the other part of the question is, um, when people, let's say, self-diagnose as being
Hmm.
traumatized, is it always real trauma?
Well, I'm looking at the time here because we could talk for hours about what is real. Um, and not every strong reaction means that there is trauma, big T trauma, or little t trauma underneath. It could be stress, it could be fatigue, it could be hunger, it could be injustice, it could be hormones. And sometimes it's just the body saying enough, because the nervous system has limits. And when we, live close to the edge, even small things can really spill the cup. And in terms of trauma, when the reaction feels bigger than the moment, it may have this flavor of, and this is if you are the individual, of a deja vu. When it surprises you, with its intensity, it can be a sign that the past has joined the present, that the body is remembering something old in response to something new. And you'll know it not by logic, but by this felt sense. Could be, heat, face, pupils, doesn't match the situation, or a shutdown that feels older than the conflict, collapsing. And it's the nervous system reenacting protection. And I don't want to pathologize every reaction, but to be curious. Is this about now, or is this about then? Either way, the reaction is meaningful because it's data.
Makes sense. Oh, did you have more? Say.
Well, the second part is, when are we using trauma as an excuse? Is that correct to say?
Mm-hmm.
Dad, do you want to take that one?
That's just human nature. We like to use trauma as an excuse. Oh, I can't do that because that'll traumatize me. It's too much. So I think we will use it as an excuse sometimes to make something bigger than maybe it actually was. But the majority of us know when something has made an impact or changed your outlook on life, you change your outlook on even on the day. Sometimes it's been such an impact. I think that's the body has been traumatized. It's been set through a charge of, because I think, the way I look at it is trauma. What originally is not always wasn't a bad thing. Okay, in terms of, if you're going to suddenly be chased by a saber-toothed tiger, that's pretty much of a trauma. But because of that reaction that your body has of increasing your adrenaline, increasing your cortisol, maybe you have a chance of getting away from that saber-toothed tiger. So, I think there's a reason why we have this response in our bodies. Uh, but unfortunately it goes awry when it's too much or it's overwhelming. But it's not always a bad thing. I mean, the actual response to avert ourselves against some life-threatening event.
That was stunning, Father. And one thing, and I'm trying to read between the lines here in the question, but if the question, may be coming from a place of a relational dynamic, it's important to consider, has a protection become a justification? So the word accountability is coming up for me, because we can use the story of what hurt us to avoid discomfort of growth. We can say, oh, that's just my trauma, instead of asking, what is my responsibility now that I know this? Because understanding trauma isn't permission to stop evolving, it's an invitation to evolve more consciously. And when we truly begin to heal, trauma stops being the reason we can't, and it becomes the context for how we can. So we move from reacting because of what happened to responding with awareness of what happened. And I feel there is a difference between explanation and excuse, because explanation brings compassion, excuse avoids accountability. And so the real healing needs both compassion and accountability for ourselves and for the ways that our pain may spill into others. So I tell clients your trauma explains your patterns, but it doesn't define your potential. So the moment you can see the pattern, you've already stepped into choice. So, yes, trauma may have been something that happened to us, but healing, that's the part that is ours then to tend. And that's where I feel that responsibility and freedom meet.
Wow. Yes, I really loved this discussion. Uh, we went so many different directions. Talked about these conditions like central sensitization, fibromyalgia, all these things that medicine finds it hard to explain. And it blew my mind, Steve, that you said it wasn't until 2017 that we realized that the brain could produce pain. Was it 2017?
Yes.
So recent. Wow. Um, and yeah, just the explanation of how unprocessed trauma kind of cascades into these physiological symptoms. And trauma is about, the relationship we have with it, not fixing it, but having compassion and accountability to guide ourselves towards evolving the relationship and towards healing. Um, Beautiful, beautiful. Well, thank you both. Do you have any final remarks?
No,
Cool. Well, thank you guys so much for listening. Um, and a question for you to ponder as you go about your day: what happens to doctor, patient, and person when the tests come back normal, but the suffering is real? Let's ponder that for a sec. All right. Thank you so much and enjoy the rest of your day.
Bye.